We will begin our event shortly. Instructions on how to register for Spanish interpretation are being shown right now. En breve empezaremos nuestro evento. Si quieres escuchar este evento en español, haz clic en el enlace que se está compartiendo en nuestras redes sociales. Saludamos a los que ya se encuentran en Zoom. Por favor, siga las instrucciones para escuchar en español que se están mostrando ahora mismo. Good afternoon. My name is Lina Guerrero, Community Partnerships Manager at La Clínica del Pueblo. It is my pleasure to welcome you to our La Clínica Talks speaker series. Just a few housekeeping notes before we begin. This is a live event with simultaneous interpretation on our Zoom channel. As such, we remind our guests to speak slowly, that way all of us will benefit from what we have to say. We will have space for Q&A, so we encourage audience members to enter your questions in the chat at any point during the program. La Clínica Talks is a space devoted to promoting healthcare as a human right for Latina immigrants and all excluded communities in the DMV. By engaging with elected officials, we promote dialogue to illuminate the barriers and challenges, as well as opportunities and solutions for our community members to access healthcare and other essential services. It is our hope that this space can bring a unique perspective on what immigrant health equity means and the steps needed to advance it. Our talk today will focus on two topics: current legislative actions to address access to healthcare in Prince George's County, and how to improve the overall health of Latino immigrant community in the county. With that in mind, I would like to welcome our future guest, Council Member Wala Blegay, representing District 6 in Prince George's County. She is a passionate advocate for civil rights, women's rights, and workers' rights, and the creator and host of the Chat with a Lawyer television talk show, a free legal resource for county residents. A grassroots organizer, adjunct professor at American University, Washington of Law, and former staff attorney for the DC Nurses Association, Councilmember Blegay has been noted as the working people's voice. Welcome, Councilmember Blegay.
Thank you all for having me. Thank you so much.
Thank you, Councilmember. Joining us is Sujana Lijales Barker, the Chief Program Officer at La Clínica del Pueblo. Sujana holds a doctorate in public health and a master's degree in social psychology. She has dedicated her career on ending health disparities related to poverty and discrimination. She is responsible for overseeing the design, implementation, and evaluation of programs that are culturally and linguistically grounded.
Hi, everybody. Happy to be here. Thank you, Council Member, for joining us in this
Thank
event.
you.
We really appreciate it.
So, welcome everyone. Council Member, I would like to start with a question. How has your experience as a daughter of Nigerian and Liberian immigrants influenced your career and decision to run as a council member in Prince George's County?
Thank you so much for that question. Let me just tell you this. My parents were immigrants, and just growing up here, one of the things I've been so active in so many advocacy for immigrants because We were not a part of the temporary status, but Liberia was in a civil war, and my dad could not go back to Liberia. And so we got really active here, going to see all of the council members when I was young to ask for support for for the TPS for the Liberian community that was coming in from the war, including cousins and everything. And that's where it really started. I got my advocacy there. I know we're talking about healthcare today, and I want to talk about actually what got me into healthcare. When I started college, I had an allergic reaction. I have a lot of have very sensitive allergies. I went to the emergency room and was told after the visit that basically I was no longer had health insurance, which was news to me. That I actually, and this was before Obamacare. Now, once you were 18, if you didn't have any health insurance, they would take you off of Medicaid, and that's what I was on. Basically, I got like a $3,000 to $4,000 bill, and for that time, that was really like almost like $1 million to me. I didn't have any money, and my parents didn't have any money, and so I had to. I was scared now to go to the doctor, like because I was scared about the fact that I would have to pay the student plan that they put us on. Had a high deductible for any type of visit to a hospital, to emergency room. So really 3,500 or something like that. So even when I tried to even get that insurance involved, it did not provide any relief. So I said, what is this that I got this bill, now it's on my credit, and I couldn't get it off. And eventually what happened was the hospital did forgive it after multiple calls, letters. I called um, the credit bureau. So it was very, very stressful. And what I decided at that moment was I started to look into the healthcare system. And I actually worked on the Affordable Care Act when I worked on the Hill, on the Education Labor Committee. And I became interested in healthcare. I actually worked for the DC Nurses Association, working on quality care issues in addition to labor rights for years. But it really got me interested in just how health insurance can impact your life. Like, I did not go to the doctor until I got a job. That's the
Yeah.
reality. Even when things were worrisome and it didn't feel right, I didn't go. I just got blessed that it wasn't anything serious.
Mm-hmm.
But I've
Mhm.
seen these things happen. I had a friend who, and this is a sad story. He's an older gentleman. He was 60. He went to the doctor because he wasn't feeling good, and they told him that he had some sort of growing stomach tumor that needed to be taken out. But he had just started the job for the first
Mhm.
3 months, and he decided that it meant more for him to at least finish the first 6 months because he would be taking over probation before he needed to go
Mhm.
take care of this tumor. By the
Mhm.
time he went back to the hospital, because he fell out after months. They said that he had 6 months to live because it
Yeah.
was a stomach tumor that was cancerous,
Mhm.
and it grew.
No, as a healthcare
And
provider,
it's,
we have this every day, right? I mean, those stories is a combination of you not understanding the system betraying you sometimes, right? And then you become afraid of what is there. So I think there is many communities who empathize also with what like a community, like immigrant community who are uninsured feels, right? Sometimes, like how you choose between the bill that you have to pay for your health insurance or the bill that you have to pay on the job and all this. And that's why I think the beautiful that we're be here today discussing is really this possibility of financing primary care, right? Special preventive care. So I think this is incredible that your experience, like I had a question for you, like how you get to, you answer all the question already. And I felt just like a similar story. I'm from Brazil, and I remember going for the first time to a healthcare provider here, not knowing English and not having a medical interpretation. So I could not. I had access to the doctor, but I could not understand the what was the treatment plan. Anyhow, I think your empathy, not only because you're a daughter of an immigrant, but because you felt yourself the struggle to navigate healthcare system, I think is pretty much your what drives you, right? So it was great to hear that.
So, council member, as you know, the need for county level solutions to expand access to care is evident. 11% of county residents and 7% of county's children remain uninsured, with Latino children being 5 times more likely to be uninsured. Also, we see that this at La Clinica, many of our patients are either uninsured or underinsured. For example, in 2023, our Hyattsville clinic served almost 1,500 patients, and out of and 63% of them were uninsured. So, can you tell us about the Prince George's Cares and Health Reimbursement Act, which we know you are co-sponsoring, and what this would mean for the immigrant community in Prince George's County?
Definitely. I would tell you this. I was really happy to know that health insurance exists. And what we were told was that health insurance was a program that was supposed to fund, look at the uninsured population, but it was actually only funded at 500,000 years ago, right? But what happened? COVID. COVID happened, and what they saw was that we saw a high number of infection rates and deaths because of the uninsured population, the underinsured population, all the comorbidities, and especially, and it was rampant in the Hispanic community when you looked at the zip codes. So they took the federal funding that came and put $5 million into that program. And that was how health insurers became a process of supporting the health insurance became a process of supporting the uninsured. And let me just explain what the uninsured is because people think it's just the immigrant population. It's the immigrant population. The numbers given is true. We have about 11% uninsured, and I believe that's underreported. I believe especially those that are undocumented are not being open and are not showing their faces until it gets to an emergency. But of that 11%, 31% of it is the Hispanic community. That's quite a bit. Others are less than 10. So when we look at that, that's troubling. Now, there's a bigger population, the underinsured, and even that is even a bigger and it's completely, we really don't know. This is those plans that if you get sick, you got to pay $4,000, right? You have a high copay and everything, that you have a health insurance, but it's really not something you could really use. And most people don't use it because they can't afford to pay the hefty cost that it takes to get the care that they need. So when you look at those two groups, you're really looking at a great need. So health
Mhm,
insurance fit into that role and it
mhm,
started
mhm,
to help. And what we see now is that we have all of these federal qualified health care, uh, organizations that are providing care, general care, and we started putting money into them so that somebody who's undocumented can get the medical visit, can get the dental care, can get all of those things. So now what I've realized is that we cannot leave this to a funding of ARPA that might disappear in the next year. We
mhm,
have to make it permanent. We
mhm,
cannot go back to the $500,000 that it was done before because the $500,000 we did before we were opened up, it's not that we didn't have the problem, it's that the problem wasn't open for people to see. And what COVID did was open the door. Here you are. Here's the problem. So the solution is this act is supposed to put forth a permanent process of ensuring that we have a healthcare program that funds the underinsured and the uninsured, ensuring that it also has higher reimbursement rates so that people don't feel like they want to get out of the system. The reality is that some of the healthcare crisis we're seeing is that we're losing so many primary care positions. In Prince George's County, we're 2,000 residents to one physician. If you go to Montgomery County, there are like 746 residents to one. That's almost double. At this point, you're more likely to get a primary care physician in Montgomery County than Prince George's. And that doesn't
mhm.
fare well for us. Practices are closing down everywhere because the reimbursement rates are so low that most of these doctors are saying they can't keep their doors open.
Yeah, and you see that there was this situation that we had even with health assurance, right? Health assurance was fundamental. I mean, La Clínica is a federal qualified health center, but we are six of us in Prince George, what is interesting, right? There is equipment, but the doors are not open as much as we could because of the limitation of the fund. Health assurance, for
Mhm.
example, the $5 million, we were able to cover almost 47,000 residents, right? And
Mhm.
that was covering on this model of care that's not only a physician, is also a dental care, prenatal, behavioral health, and nutrition and health education. And this when you put this amount of visits against the 5
Right.
million, was around $100 per visit. So $100 per visit don't cover that. It's impossible, right?
Right.
So I think we love health assurers, but we love also that health assurers inspired you to go to something more consistent, more, and as you said at the end, that will attract more people, more physicians or more primary care providers, right? Because I think we understand more and more and more that if you provide preventive care, it's a saving long term. Probably now is going to have investment because there's so many people sick, right? Your friend
Mhm.
that just had a tumor. This is a primary care can also find everyone out that needs complex. So it's not going to be saving money now, but long term, and also having a community who is safe enough. I mean, it's proven the best model, right? It's proving that you put energy and financing on primary care, you can help those two things. One is morally right. It's better prevent people to get a cancer that is not treatable. And early detection of cancer nowadays can save lives, can prolong people's lives.
Right.
Diabetes, hypertension, that's so common. La Clínica is also a house of the LGBTQ community. We prevent so many people from dying from HIV. Now, HIV for us is a chronic disease. If you come to us and you get treatment, you live your life being medicated with your viral load suppressed in a level that you don't transmit the virus outside and you live a longer life. So we love primary care. And we're very happy that this energy in Prince George now is, as we see this everywhere, the health department is always liking it. So there's many places, right, that people are talking more and more and more. And we believe this is the kind of the silver lining of the pandemic. This is something that came with this tragedy that we lived between our community. We have so many deaths, and we had to let go so many people. But I think as an outcome has been this movement. We are very
Right.
happy.
Right. Well, thank you so much for your work. And I would just tell you work. It is God's work that you're doing, so providing support. I mean, many of the doctors that I know just want to care for people, but after it's like fighting money, fighting insurance companies, they're like, I want the easy life. And you all are saying, I'm in for the fight.
Hmm.
And it is admirable, really.
Yeah, yeah. Thank you for the recognition. Yeah, this is sometimes feels like is a hidden work, right? Even though gets, I think sometimes the problem is the community would like us to do more, and
Right.
when we cannot answer, also the community needs sometimes feels like nobody's doing anything, and we are, right? And not only La Clinica, but the 6 federal health centers in Prince George, they are pushing. Uh,
Right.
but there is a need. One thing that is important for us to also say too, sometimes we put like uninsured with undocumented. There is a lot of people who has temporary status permit, like the story that we're telling about Liberians. The TPS, you can live in this country, can work in this country, pay tax in this country, but we don't have access to any affordable health care.
Right.
You cannot go into. So now Maryland just opened up for us to at least buy insurance in the state, but not with subsidies. So now a person that's going to buy probably is going to buy a more affordable, but um, people living in poverty is not going to be able to even buy that affordability because it's
Right.
still for them not any federal subsidies for the healthcare. So for us to only think about this, we are not. Sometimes we put those categories of people. Why we're helping these people, even though I believe we should help every single person, no matter
Right.
what, especially on healthcare because it's make all of us healthy. But it's important not to get trapped also in some rhetorics that misrepresenting the people that we are trying to help.
Yes,
Well,
I agree.
and also, council member, you know that healthcare is health is more than healthcare, right? So we conducted a community health assessment recently with 77 community members, and 43 participants were living in Prince George's County. And we found that the most prevalent barriers that they found were access to healthcare, other than access to healthcare, were income and occupation, immigration status, access to food, and language access. Given what we know about the social determinants of health and their impact, what steps or policies can the Council take to address these barriers and improve the health of Prince George's County residents?
Well, that's why we did the Prince George's CARES Act, and because we want to actually increase funding to federal the FHQs, the federal qualified healthcare centers, and let me just explain why. Those are the places where someone can comfortably go and get all of the care they need. And that's a place where they can connect you with places that can give you food. They can connect you with places that can give you mental health support, things like that that you need. But if you don't have health care, what you don't want is right now we have overrun of our emergency rooms. Our emergency rooms, I created a task force to address this. And one thing we saw with the emergency rooms was that a fourth of the care that comes there is uncompensated, no healthcare insurance, or just non-emergencies. So what happens is, and I gave the story of myself, I didn't have health insurance, so I didn't go to the doctor. So there were things that would be bothering me, and I just won't go because I was too scared. Like I can't afford. What if they give me this bill that's $6,000, and I got more debt that I got to deal with, and I can't take that right now. And then what happens is that sometimes something happens, and it gets so bad that you got to go to the emergency room, and that's where you have to get all of these things, and you're not really taking care of yourself. So what we want to do is encourage people that if you don't have health care, it doesn't matter. Go to this clinic. They're going to give you all the support, and it's not going to matter your immigration status. It's not going to matter whether you have health insurance or not. So that's why we want to be able to give the funding of that program permanently, because it really we COVID opened us up to show
Mm-hmm.
there were many people that weren't getting care. So
Mm-hmm.
when a disease came, they were impacted, and then some of them died because they had been withholding health care because they were scared of health insurance. And that's what we're trying to break that barrier. If I have a friend, like I told you about the guy that I told you about,
Mm-hmm.
he died, and it's simply because he did not have health care. That is it. Because if he went to a place, we could have found some care for him. He could have probably gotten the tumor removed, and he would be still with us now. But because he had a new job, and that's the problem and the thing. I've been a Medicare for all person, but we got to get there. While we're not getting there, that's why we need to get this bill passed so we can get the support for those. Because if you've got a health insurance that you just started a job, sometimes you got to wait till that health insurance kicks in. It's got high deductibles, and somebody says, I don't have $4,000 to go see a doctor, so I'm just not going to go. And so we just wanted, that's what we need to do. That's why we really try to get this bill passed. We have a hearing probably in September. We're going to keep everybody informed, another follow-up hearing. It is very expensive. The county executives group have come and said that it's very expensive. But why is it very expensive? They're focused on the money. But here's what we said: it has to be done because we're going to spend anyway. Either
Mm-hmm.
you're going to spend
Mm-hmm.
on trying to find ways. Right now, we're at the state looking for ways to expand the beds in the hospital, do all this stuff. The beds are full. You want to know why? Because the emergency room is full.
Mm-hmm.
So then they have to, every time you lift up a bed in ICU, you got somebody moving out from the emergency room. They call it throughput, where they put them in in ICU. And
Mm-hmm.
why? It's because sometimes the people are not getting care, and when you're uncompensated, you wait to the end, and something really now serious happened, and you got to sit in the emergency room. So you're gonna pay anyway.
Mm-hmm.
So it's like either you pay at the front end, provide the support for the healthcare center, or you pay for all of the things that come with not providing the care that's needed.
Yeah, and I think this is the fundamental. It's so great that you understand healthcare, right? Because I think something also when you're advocating, I feel that many people do not understand how healthcare functions. If sometimes we have your own insurance and then you go to the doctor when you need, but you don't know. I've been in our experience educating council members and educating other public elected officials. What we miss sometimes is that lucidity that you have, right? Because
Mhm.
you've been trained, you've been there, so there is something about understanding the nurse work, right? You've been close to
Mhm.
the nurse, so this is fundamental. One thing that for us also, that description that you gave, right? A health, which I call this community health center, right? Can be federally, but a community health center is not only a provider, but is also a group of people, a team working to address wraparound services to
Mhm.
address those needs that go beyond healthcare, right? Because A doctor can prescribe a medication for diabetes, but the person does not understand what can be eaten or not, or the level of exercise. It's really hard, right? Sometimes we have two jobs. The only thing that we can have at the end of the day is fast food. So until the person start understanding that, it's hard. It's not hard because the person is not intelligent or the person didn't go to school. It's because the day to day. I think you thought about your friend, right? He had to keep 6 months on the job, right? The day to day tasks and the
It's
how hard it is make us to make those decisions, right?
right, right.
So
Well,
the
I want to jump in about the
uh-huh,
preventative care part,
sure, go.
because that is where our healthcare centers really need the funding. You talked about this, but I could tell you this is a personal thing. I'm pre-diabetic, but one thing is that I have Kaiser insurance, and I went there one time, and they started looking. They say you're pre-diabetic. You need to cut out this and this and that. And I've struggled with it, but at least I'm aware that I have it, right?
Hmm.
So I
Hmm.
know what I need to start cutting out, and so it does make you start thinking, okay, I got to take a salad. I can't take
Hmm.
these fries, things like that. I had a friend that didn't go to the doctor, right? And I think that if he did, now he has kidney failure, right? And he's in his 30s.
Hmm.
So if you have that, that in itself is what happens when you don't go to
Hmm.
the doctor.
Hmm.
And we said that because a lot of our males don't go to the doctor, right? A lot of our men,
Yes.
as women or with the lady, all of the babies, things like that, we're
Hmm.
always having to go to the doctor. But men don't have to go to the doctor. So when they do go, sometimes they get the alarming news like, oh wait, your kidney is failing because you really have been eating so much sugar that you're now, that there's some things. So there are things that preventative care can really save lives. And
Hmm.
what we don't want is our undocumented, uncompensated care group to just not show up to the doctor.
Hmm. Yeah, and be also afraid of not being understood, right? Because one thing that I think the model of care that we have this, especially the community health workers, right? We have community health workers around us who are trusted members of the community that with us educate the people, right? Because the education is pretty much a translation of science to that day-to-day life.
Right.
Sometimes when we have health system who speaks a language that is so like away from day-to-day life, people hear this but they don't get it, right? Because so translation, we call this health literacy, improving the capacity of people become health literate, right?
Right.
Meaning if I tell you that you have diabetes, I explain to you your system functions, and you can have way to explain to people without using those big huge
Mm-hmm.
scientific names that only doctors know because they went to school. We can put this on the day to day because there is a lot of wisdom from people about their bodies and about their lives that in a dialogue with providers. In our case, for example, being able to provide this in a bilingual way, right? Our staff, 90% is bilingual. So a person, when they walk into a clinic and they're sometimes they even are bilingual too, but they prefer to talk about themselves in Spanish. So they
Mm-hmm.
talk about problems in Spanish. It's not that they don't understand English, it's that like that delicate or a language that you learn at home, you didn't learn professionally. So, and any community who feel discriminated, they need to feel safe, right? You don't want
Right.
to go to a doctor. To doctor tells it's your fault because you're sick, is your fault because you do this and that. People don't go. Say, why are we going to a doctor if the doctor is going to pretty much tell you you do everything wrong and it's your problem? So
Right.
I think community health center has that historically was created for that. Community health centers comes from the social movement. Actually, from the movement started in the 60s to on a war on poverty. We have many strategies in US to war on poverty. The community health centers come from that movement of including people on the programming, including people. We just did this assessment, as Linda mentioned, where people told us what they think is the problem, and they told us what they think is the barriers. Having that door open also promotes safety. And if you feel safe, there is more likely that with small steps, you may change your behavior, right? With small steps, you start eating differently. With small steps, you understand where you can get food that's healthier and
Right.
where you can get help, right? If we, what is a SNAP? What is weak? There's so many benefits that people
Mm-hmm.
don't use because they don't feel safe going to a places and applying for it. It's this
Mm-hmm.
huge form. It feels like you're a loser and you're getting this because you're no, nobody's a loser, right? Everybody's
Mhm.
trying to survive and move on. And I think health centers can have that safety for people. So I'm so happy that you see that too, and you
Mhm.
understand that combination, right? Of uh, health is about being comprehensive. Health is about being holistic. It's not just giving people a diagnosis and then a bad news and then go home. So
Okay.
uh, it's a struggle. It's not easy, but anyhow, Lina, do you have more questions for the customer?
Well, we would like to know, La Clínica, our community, how can they get involved? How can they support you with this legislation that will advance immigrant health and health equity in the county?
Great question. We actually to reach out to our office, Council District 6 at co.pg.md.us. And I will tell you this, we do expect there will be a follow-up hearing on this issue in September when we go back in session. And we would like to pack the room,
Mm-hmm,
show the support because there's a lot, it is a lot of money, and the council and the county doesn't have a lot of money. We had a $5.4 billion budget, and really there was a lot of issues here, that things that we couldn't fund, but at the end of the day the squeaky wheel gets the oil. And as spoke to the administration folks, we have to do something to set a permanent process in place, because we don't want to get caught with our pants hanging down again. COVID opened it us up, and frankly, you don't want a community where you have people dying from preventative issues if they just went to the doctor. You just don't want that community. And we as a government have failed if that is what we have. So what we need to do is show to everyone, and I will be speaking on your behalf, but show to the administration, like, look, let's come up with a solution. They should be forced to come up with a solution that's permanent. Because let me just tell you why we don't want to just keep it the way it is. Health Assures is just a program that's in the budget of Department of Health. It can be snatched out at any time. It almost was.
mm-hmm,
When we reached out to the administration before we raised our voices, we were told that we were looking at maybe 500,000. They didn't
mm-hmm,
want to give a number. Maybe they got to let us know all this stuff. It was when after we started to raise our voices and get loud that we started to hear more money coming in. And you don't want to have to deal with that every year. Because to me, if we're putting up, we fund the school system. Nobody says, okay, maybe we'll fund the school system this year, maybe we won't. Because we as a society decided that funding the school system is important for our
mm-hmm,
democracy. It's important for our community, for residents. Same thing with healthcare, and healthcare impacts a whole wider range of people. So we're not just talking about kids; we're talking about every age range impacts from this. So we need to make sure that we're making sure each person, every person, healthcare is a human right, and every person that is on every resident, all 1 million residents, should have access to quality healthcare.
So we have some questions from the audience. So one is why I think you kind of answered right now, but the question is why not to leave it to the state and federal government? Why to do something local?
Because we have to scream and shout every time, and there does seem to be a dismissal of sometimes healthcare until something happens, until someone dies. And with this one, it was until COVID came, right?
Mm-hmm,
And what we have to realize is that a sick community is not a healthy community, and it's not a thriving community. You don't want people to be, we don't have we shouldn't have a community where people are dying from kidney disease and things like that because they simply didn't go to the doctor before, and then now it's too late to save them. So that's why we want to jump ahead of it and make it, no, there's no district in the United States that doesn't have a school system. In
mm-hmm,
some other countries, they don't even value the school system the way we do. And we
mm-hmm,
do that because it is the culture in the United States to do it, and we should do the same thing for healthcare.
mm-hmm.
That's great. We have another question. It says, how can I, as a community member, have a political impact on what happens in Prince George's County?
Show up to the hearing. And as simple as that, we definitely have people come, but we need to pack the room. People need to know there's something about seeing the visual. I've told people this all the time. when we go out and advocate, if you have nobody in the room, people will say, "Well, this isn't a big issue," and it's a real thing. We're politicians. I don't want to be. call myself an elected leader, but politicians respond to people sitting in the room looking at you, demanding, and it is something mighty for someone to say, "If you don't vote for this, I'll make sure you would never get back in office," and that really can be a motivator for most people who are elected officials. Show up, tell them, "Look, I'm here because this is what I care about. And if you don't vote for this, there might be consequences."
Yes, it's true. Thank you for those answers. I don't know, Sujana, if you have anything else.
No, I think this. I think this is so inspiring, right? I think also the way that you talk about participation, because I think some of us cannot vote, right? Yet.
Right.
So voting is not an option. And sometimes we think political participation is not only voting, but also political participation is really following what how decisions are making, right? How money is distributed, how decisions are as you just said, right? Some of this is the society that we want. It's not that it's impossible.
Right.
I think I love the example of the schools, right?
Right.
In some point, our society decided the school was priority, and we found a way to fund it. So it's time to think health also as a priority, not a benefit, but a right. So it's very inspiring, council member. Thank you so much for your time. I know how busy you are. I think having that, this is keeping also recorded. We are now live stream, like that kind of dialogue live stream, but this get recorded, and we keep using this too in our trainings, in our when we went to organize community engagement, so people understand with us that. As you said, a healthy community is a is a community that everybody feels they have the same opportunity. And if you're sick, it's really hard to to go after opportunities or even help the community to get better, right? So we need everybody in that level feeling the same
Yeah.
uh, energy.
Thank you, council member.
Thank
Also,
you.
thank you in the name of our community. Thank you for championing um, primary care, because we know it's very important. It's something that will let our communities thrive instead of struggle every day. So I appreciate taking the time to talk to us, and please count on La Clinica to support this fight.
And thank you so much for your work in the community. It's really, you save lives every day. And that's something that needs to be stated.
Great. And you who are here joining us, stay tuned. We're going to be promoting any hearing, any new development. So, like Clinica's social media channels and our website, we're going to be promoting as much as we can everything that's happening in Prince George so we can help to move this forward. Thank you, everybody.